We start with Dr. Richard Carmona. Governor Doug Ducey hired him last month after Dr. Kara Chris stepped down as the state's health services director. Ducey also named an interim health services director. Carmona has a $400 an hour contract that runs through the end of this year. He says his mission is speeding up vaccinations to banish COVID-19. Dr. Carmona, welcome back to Square Off.
Nice to see you. Thank you.
I've seen you describe yourself as leading the state's COVID-19 response. Help us understand what that assignment means.
Sure. Well, that's not the way I described it, but I think that it's been out there in the media. What I am is a senior advisor to the governor on public health emergency preparedness, which includes COVID, because it is an emergency and has public health implications. So what I do is to advise the governor, as well as Don Harrington, who is the acting director, and the senior staff on best practices as to everything from vaccination, mitigation strategies in public health, things like that.
Now, by the end of the year, where do you hope Arizona will be when it comes to some of the COVID metrics I rattled off? It appears cases are plateauing. It appears our death rate is one of the highest in the country. Vaccinations are lagging. Hospitals are under a lot of stress. Where do you think or want Arizona to be on those metrics by the end of this year?
I think the most important metric I would like to see is that the majority of our citizens are vaccinated. That is the ticket to success, not only to keep people out of hospitals and keep them healthy, but also for economic vitality so that we can keep our restaurants, our hotels open, our parks, our schools. We're suffering because of the unemployment, the increasing debt because of COVID. So it is economic health as well as physical health. And if everybody gets vaccinated, we'll be able to return to normal as quickly as possible.
Now, you've talked about taking politics out of this. You've talked about changing the narrative. What do you see as the politics and what is the narrative surrounding vaccinations?
First and foremost, I think the easiest way to describe how this all evolved was the discussions I had with the governor. My opinion was that governor, not only Arizona, but we're spending far too much time divided in this United States. In fact, we're a disunited states when it comes to how we approach this. And often it's along political lines and words that are inflammatory, like mandate. I said, as each side argues pro or con mandate, people are still getting sick, people are dying. I'd like to help you if you want me to help you and help the state. It's a privilege for me to serve again. But my goal is to make sure that everybody gets vaccinated and we practice these public health mitigation strategies. I am not going to be getting involved in discussions of politics that are divisive, like mandate issues, because what we need to do is get people healthy by getting them vaccinated. Now, the challenge has been keeping the politics separate. So when I put my stake in the ground, I said, I'm a professional, I'm a health professional, and what I want to do is make this the value proposition. He agreed, and he said, Rich, you're right. There's far too much divisive politics going on. Let's put it aside. Let's inspire people to be able to get vaccinated, to understand that they have the power to return normal in their businesses, to stop unemployment, to keep our football stadiums open by getting vaccinated and appropriate public health mitigation strategies. So the governor and I have agreed on that, and that's the value proposition we're moving on. We have a strategic communication plan we're developing. We're dealing with just about every element of society, the Arizona Chamber recently, all of the chief medical officers in the state of Arizona. So we're building a team of individuals and groups who feel the same way we do. We have the power to accelerate getting out of this, but we cannot not do it unless everybody gets vaccinated.
You talked about, sticking to the best practices in COVID mitigation, doing the right thing. You said in a blog post last week, the governor has consistently shown he's looking for the right answers to the complex problems. And yet what we've seen in the recent record is that under Governor Doug Ducey, Arizona's become one of the leaders in the country when it comes to banning some of the best practices. He blocked Arizona State University from its own vaccination and testing plan. He threatened to cut off cash to school districts that try to impose mandates that they believe that educators and health professionals say are the best practices for dealing with outbreaks among children. And he rewards parents who want to leave schools if they don't like what's happening there, if they don't want their kids to be quarantined or don't want their kids to wear a mask. Would you call that a best practice? Would you call that the
Yeah.
best answer?
Great question. And the issues you bring up are precisely the ones that bring no value to getting people vaccinated. The legislature, in their wisdom, has voted a lot of things that maybe some people disagree with. And as you know, there are multiple lawsuits popping up around the country that will take months, if not years, to resolve these issues. And often it is individual right versus the collective right of society, whether it's smoking or whether it's COVID testing or COVID vaccines. And my take on this when I went to the governor was, that's all behind us now, okay? You've asked me to help you. I've given you my best opinion on what needs to be done. The fact that we're arguing over mandates, we're arguing over other things that are not germane to the health, safety, and security of our population, that's not where my interest is. My interest is in ensuring everybody gets vaccinated and are using the best public health practices. I've been dealt the hand that I have, and I have to work with that hand. Okay, and that's what the government, the legislature has passed into law. But I'm not going to let that stop me. And the governor agreed. He said, let's work together. Let's make sure that we get everybody vaccinated, and let's make sure that they're practicing these mitigation strategies. Now, Bram, you know this state as well as I, if not better. The state is divided. There's a large population that doesn't want to be told what to do. Now, we can continue to argue that, but that's not helping the patients. So we're going to do everything we can to inspire everybody, even the vaccine hesitant, as to why it's important. That's why we're reaching out to businesses. That's why we're looking at the economic impacts. That if you own a business and you didn't get a vaccine for whatever the reason, and your business has to shut down, I can tell you we can get your business open if you and your colleagues all get vaccinated, and we're able to move toward herd immunity. So that's the way I'm working on this, and I'm staying away from these divisive, hyper-partisan political arguments for which the public gets no benefit.
But I can hear parents and educators and healthcare professionals say, yes, there is a benefit from these mandates. The Maricopa County Health Department pointed it out a couple weeks ago, showing that schools that have mask mandates are far more successful at stemming outbreaks. So on their side, it's not a political argument, it's a health argument, isn't it?
Understand, Bram, for sure. And there are those now in the literature that are publishing that the mandates are actually accelerating hesitancy in some groups because of this fierce sense of independence, that they don't want to be told what to do. So there's two sides to the story. But us debating that now and deciding if we're going to file a lawsuit and all of these things that are going on in the rest of the country, because this is not just Arizona. I think there's 24 attorneys general now suing the federal government on this issue around the country. What is the benefit as that rolls through courts for years as to if it's right or wrong when people are sick and dying? So that's why my focus is on the health of this. Now, Arizona has set up a framework that whether I agree or not doesn't make a difference. It's the law. So I'm doing everything I can to circumvent that, to get to our patients, our citizens, so that they understand that vaccination is absolutely important for their economic vitality and their health vitality, and mitigation strategies as well. The governor has agreed to support that. We agreed to do public service announcements together and such, but politics is not my issue. I am not going to get into those divisive arguments if it's good or bad. I'm going to play with the hand I've been dealt, and I'm going to do the best I can. I've met with our chief medical officers yesterday from around the state. I met with the Chamber of Commerce, and we're aligning a group of people who understand that it's not to the benefit of the community now to argue these things where you have to change the law, in other words, and that's okay. I hope that people continue to express in a democracy what they want, but that's not helping us day to day as our hospitals are full, as our nurses are tired, as we have COVID exhaustion, and we're having to triage patients because the regular sick people have no place to go. So again, stay focused on the mission. The mission is get everybody vaccinated and use the appropriate mitigation strategies. And that's what I'm about. Not going to get involved in divisive political discussions.
You talk while you're working with a politician, the governor.
Yep.
He's a politician.
Yes.
You say you're going to appear with him in ads. And again, I wonder, is he the best messenger given the mixed messages we get?
Yeah, that's a really good.
Don't wear masks. Don't follow the mask mandate. But I'll reward you. I'll give you money to go to another school if you don't want to follow them. get vaccinated, but Joe Biden's a dictator for, wanting to require vaccinations or tests. Isn't he sending mixed messages?
Yes. Well, Bram, so here's how I look at it, okay? There may be mixed messages. Again, they're a mix for half the population. Our state is pretty divided, as are disunited states right now around this issue. And that's a shame, because we are at war with an invisible foe. And where we should come together as Americans, and now we're coming together as Democrats, Republicans, independents, and God knows what else. We need to come together as Americans and defeat this foe that we are at war with. The governor has an opportunity here to step up and stay out of that political mandate thing, but to be able to tell the people, listen to Surgeon General Carmona and me. We want you to get vaccinated, okay? We want you to take the appropriate public health mitigation strategies. He is willing to do that. And so what can he do as a governor? Here's one I think. As a governor who represents a party who's in charge of the National Governors Association, he actually can take actions that would be rippling across the country, not only in our state. He can free up a lot of people who are politically aligned with him, who are not going to get a vaccine for those reasons, and maybe they will get vaccinated since the governor says it. Now, we're not going to get everybody. There are people just fiercely independent in Arizona that don't want to be told what to do. But if I can get those people sitting on the fence, and I can get up to 80, 85%, and our children get vaccinated in October, November, then I can achieve herd immunity in an accelerated fashion, stamp out the transmissibility, and then we're closer to getting back to our new normal. That's the focus here, not the divisive politics.
With all due respect, I think your challenge is we've seen the governor act for a year and a half, and much of that time we have seen him be a part of divisive politics, really right up to the present day. You agree with that?
I'm not getting into divisiveness. There are actions that the governor has taken that maybe I would disagree with, as well as governors around the United States, as well as the president of the United States. I don't think any of us agree with every politician on everything, but that's not the issue. The issue now, people are sick and dying. Our health professionals are exhausted. The beds are not available for sick people. We have people with chronic disease who can't get care because COVID people displaced them. We must stay focused on the mission, and that is getting everybody vaccinated and practicing the best public health mitigation strategies. The politics are not helping us.
President Biden says the time for talking is over. He wants to require workers to either get vaccinated or get a COVID test. Do you support that?
Well, what I support is everybody getting vaccinated. Where people refuse for whatever their reason, okay, and vaccine hesitancy is a broad term. There are many reasons. People don't understand this, language barriers, cultural barriers, and there's those that just don't want it. So where people refuse and you have to go to a plan B, then there should be testing, because our goal is to prevent transmissibility. In the perfect world, everybody gets vaccinated, just like we do with our children. Why don't we see polio in the world today? Because we vaccinated. How about tetanus, whooping cough, measles, mumps? When you're vaccinated, you don't see those diseases. This is just another disease coming into our environment that we need to address appropriately. Where people resist, in order to protect society, we must then have a plan B. And the plan B is, okay, if you don't want it, then we need to make sure you're not making everybody else sick. You're going to have to get a test. So that's a reasonable thing, because people are refusing, for whatever the reason, to do the right thing, which is get vaccinated.
So you support the president telling OSHA, make this a workplace requirement?
I didn't say that. Okay.
Well, I'm trying to figure out. Yes or no? Do you support that?
Ram, I'm really clear what I'm saying. I don't have to support a politician on anything. I'm telling you what the best science says. Okay. The president will say something. Governors will say something. Yes, I know they're politicians. That's fine. Some of them say the correct thing. Some of them don't. I'm here as a Surgeon General to tell you, and as I've told the governor, the right thing is that everybody needs to get vaccinated. If we have people that refuse for some reason, or even legitimate reasons, that religious beliefs or maybe medical belief, then you must get tested, because I want to make sure you're not spreading disease. That's the right answer.
All right. Dr. Richard Carmona, thank you so much for joining us.
Thanks so much. Nice to see you again.